and that's all. Let's talk about the story, a pioneering technique being used at Sheffield's Hallamshire Hospital to help patients with an eye condition. The use of the non-invasive treatment helps maintain vision and reduces the need for injections. Ophthalmologist Christopher Brand told me more about the problem.
This is a condition that patients develop, obviously, with age, as the name would suggest. And at the back of our eye, we have a barrier layer. And as we get older, there are changes associated with that barrier layer, which we call age-related. And if there's no leakage across that barrier layer, we call it dry age-related macular degeneration. And that is not that uncommon as we get older. However, some patients then develop leakage across the barrier layer, and that can have a devastating effect on the central vision, and that is what we refer to as wet age-related macular degeneration.
Just explain the therapy that you've been administering then.
Up until now, most patients will receive injections into the eye. In Sheffield, though, for a number of our new patients, we're combining the injections with a low-dose radiation or X-ray treatment, and we have found that we are getting better results with this combination of treatment than we are with the injections alone.
What kind of difference are you getting?
We have found that in the when we look at the patients we have treated over the past year compared to patients that we would have treated perhaps 18 months ago, that the visual acuity we have got better results, and that under analysis is statistically significant, and also that the patients that have had the combination treatment have resulted in requiring fewer injections than those that didn't have the combination treatment.
Is this treatment available to everyone who needs it then?
Yes, it is available on the NHS. There are a few areas where sometimes the health authority or the commissioners haven't funded the treatment, but as we move forward and the evidence that we're now showing, we're hopeful that it will be available to everybody. It's not something that people need to pay for privately in the areas like Sheffield and some of the surrounding cities like Rotherham and Barnsley. So it is available on the NHS for a significant number of patients.
And will it be rolled out to a larger field?
I would hope so, given these results. That will depend upon local commissioners looking at the evidence and seeing if they feel it will be cost effective for their patients. We certainly have found it to be cost effective, and therefore I hope it would be found in other areas to be the same.
And where did you come up with the idea that low-dose radiation in conjunction with a normal procedure would actually be effective?
There was a trial a number of years ago, and they used it on patients that had previously been receiving injections for a prolonged period of time. When I looked at the evidence for the use of this treatment and the patients it seemed to work in, it made sense to use it earlier in the disease process rather than later on. And that was encouraging, because Sheffield was the first area in the country to start using this treatment and in this group of patients. And now that we're 1 year on, seeing these results has given us a great deal of encouragement.
Some great results then in Sheffield. Jonathan Brand.